Hi, everyone. Gilliam Elliott here. When people discuss medical travel, the conversation often focuses on patients traveling abroad for better or more affordable care. But that's only one side of the process. The other side involves the countries that receive those patients and how they manage international patient demand. These are known as inbound medical tourism markets. Inbound medical tourism happens when patients travel into a country from abroad to receive medical care. Hospitals in those destinations actively serve international patients and often develop dedicated programs designed for them. Today, we're going to talk about how inbound medical tourism markets develop, what factors shape them, and how the arrival of international patients can influence healthcare systems in those countries. But before we dive in, take a moment to like the video and subscribe to the channel to learn more about the world of medical travel. When you look closely at the medical travel industry, you see a clear pattern. There are certain countries that consistently attract large volumes of international patients, and that does not happen by accident. There are several factors that shape an inbound medical tourism market. It starts with healthcare infrastructure and physician expertise, but it also requires a solid international reputation, competitive pricing, and easy accessibility for foreign patients. One of the most important factors is medical specialization. Over time, some destinations become well known for performing certain types of procedures. Hospitals in those locations handle large numbers of those treatments, and that concentration of experience attracts patients from around the world. Another major factor is healthcare investment, which is often driven by proactive government support. Countries that want to attract international patients often invest heavily in hospital infrastructure, modern surgical technology, and internationally trained physicians. In many cases, governments also provide tax incentives, grants, and specialized medical visa programs to help their local healthcare sectors compete for international patients. Affordability is also a primary driver for these markets. Many international patients travel primarily to access high-quality medical care at a fraction of the cost they would pay in their home country. This price advantage, combined with high standards of care, is what allows these destinations to attract large volumes of international patients. Accessibility also plays a role. International patients often prefer destinations that are easy to reach, have well-developed airports, and offer visa policies that make travel relatively straightforward. Language services and international patient support also contribute to this growth. Many hospitals develop international patient departments that assist foreign patients with scheduling, translation services, and travel coordination. These programs help reduce the challenges that come with receiving medical care in another country. Many inbound medical tourism markets also see the development of local support networks that assist international patients throughout the treatment process. Medical tourism facilitators often play an important role in these environments. They help patients evaluate hospitals, communicate with clinics, coordinate medical records, and organize travel arrangements. As inbound patient demand increases, more facilitators and service providers tend to emerge in those destinations to guide patients through the process. Over time, these improvements begin to influence the healthcare system itself. When international patients start traveling to a country for treatment, hospitals often expand their capabilities. Facilities invest in advanced technology, surgeons gain experience performing complex procedures, and medical teams develop systems designed to support international patient care. In many cases, this can raise the overall level of care available within that country. Inbound medical tourism can also influence the local economy in the areas where international patients travel. When patients travel abroad for treatment, they often remain in the destination for 1 to 2 weeks, depending on the procedure, so they can recover and attend follow-up appointments before returning home. During that time, they use hotels, transportation services, restaurants, and other local businesses. In some destinations, entire districts develop around hospitals that commonly treat international patients, with nearby hotels, recovery accommodations, pharmacies, and transportation services supporting those visitors. Now, let's take a look at a few well-known destinations where inbound medical tourism has become highly visible. But before we get into the examples, it's important to understand that many countries around the world see a high volume of international patients. The destinations we're about to discuss are just a few well-known markets, not a complete list. One example is Turkey. Turkey has long been recognized as a hub for procedures such as cosmetic surgery, hair transplantation, and dental treatment. Many hospitals and specialized clinics there are built to handle large volumes of international patients. Another major destination is Thailand. Thailand has developed a strong reputation for international patients seeking treatments ranging from cosmetic procedures to orthopedic and cardiac surgery. Hospitals from Bangkok in particular have built extensive international patient programs to serve visitors from many parts of the world. Colombia is another significant destination. Major medical centers there provide top-tier dental care and a wide range of cosmetic and plastic surgeries. Colombia offers a combination of highly experienced surgeons and a well-developed hospital system. Another destination often discussed in international healthcare is Singapore. Many of the hospitals there are known for advanced technology and highly trained specialists. They focus heavily on complex treatments and specialized treatments that require the latest medical technology. And in East Asia, South Korea has a strong reputation, especially in cosmetic surgery and advanced medical technology. Many of the hospitals in Seoul are known for having some of the most modern facilities in the world. But again, keep in mind, these are just a few examples. There are dozens of other destinations across Europe, Asia, Latin America, the Middle East, and Africa that also attract a large number of international patients every year. At the end of the day, inbound medical tourism markets develop where healthcare expertise, infrastructure, and competitive pricing all come together. When hospitals invest in advanced medical technology and build systems specifically for international patients, they create the foundation for a successful medical tourism destination. Understanding how these markets form helps professionals better understand how the global medical tourism industry operates. If you're interested in learning more about how this industry works, we've created a certification program that shows you how to start and grow a successful medical tourism agency. To learn more, visit the links in the description below. Thanks for watching, and I'll see you in the next video.